Julia Hartley-Brewer raises alarm over NHS pressures. Can the system cope much longer? In a recent radio segment that quickly gained traction online, Julia Hartley-Brewer, broadcaster and political commentator, offered a sharp critique of the National Health Service, warning that the current strain on the system may be far worse than the public is being told. Her comments sparked renewed discussion about the future of the NHS, what's driving the current crisis, and what real solutions might look like. Welcome back to the channel, your space for balanced and fact-checked breakdowns of the UK's most pressing political issues. If you want more clear-eyed coverage without sensationalism, don't forget to like, subscribe, and tap the notification bell so you never miss an update. Let's break down what Hartley-Brewer said, the facts behind the NHS crisis, and how politicians across the spectrum are responding. During a recent Talk TV broadcast, Julia Hartley-Brewer voiced concerns about the sustainability of the NHS. While she acknowledged the dedication of frontline healthcare workers, she argued that the current system is being propped up by outdated structures, poor management, and unrealistic political promises. "We keep throwing billions into the NHS and expecting different results," she said. "The system is broken not because of the staff, but because of the way it's run and the unwillingness to admit that it needs fundamental reform." She also questioned whether politicians are being honest with the public about what's really happening inside the NHS, particularly when it comes to waiting lists, emergency care bottlenecks, and GP accessibility. To be clear, concerns about the NHS are not new, and Hartley-Brewer's remarks align with growing concerns among experts and the public alike. Over 7.5 million people are currently on waiting lists for treatment. A&E departments have seen record numbers of 4-hour-plus wait times. GP appointments are increasingly difficult to secure, with many practices understaffed or overbooked. Additionally, the British Medical Association, BMA, and Royal College of Nursing, RCN, have repeatedly warned that staffing shortages, funding limitations, and low morale are creating dangerous conditions both for patients and healthcare workers. So while the tone of Hartley-Brewer's message may have been blunt, the data does support the view that the system is under significant pressure. One of the key debates her comments have reignited is whether the NHS simply needs more money or a total overhaul of how it's structured and delivered. Supporters of the current model argue that the NHS is a vital public service that must remain free at the point of use, and that funding cuts and underinvestment by successive governments are to blame for the current state of affairs. "You can't run a world-class health service on a shoestring budget," said one GP interviewed by the BBC. "We need investment, not privatization." Critics, including Hartley-Brewer, argue that throwing money at a broken structure won't work. They call for more transparency, better management, and a willingness to explore alternative delivery models, possibly incorporating elements of private sector efficiency while maintaining universal access. This is not a fringe idea. Health policy analysts across the political spectrum have raised similar questions. Even within the NHS, there's growing acknowledgement that structural reform, including digitization, staffing reform, and outcome-based funding models, may be necessary to avoid collapse. Online, public reaction to Hartley-Brewer's remarks has been divided, but nearly everyone agrees on one point: the NHS is in trouble, and action is urgently needed. Some social media users praised her for saying what many politicians won't, calling for a grown-up conversation about the NHS rather than sticking to talking points. Others accused her of framing the issue too narrowly, ignoring factors such as rising demand, an aging population, and the long-term impact of the COVID-19 pandemic. "Yes, reform may be needed," wrote one commenter, "but we can't ignore the damage caused by years of underfunding and staff burnout." This tension between acknowledging the severity of the crisis and agreeing on what to do about it remains one of the biggest challenges in modern British politics. Prime Minister Rishi Sunak has pledged to reduce waiting lists and increase NHS funding, but progress has been slow, and the public remains skeptical. Labour leader Keir Starmer has also promised to prioritise the NHS, suggesting reforms such as improving access to care and investing in AI and data-driven decision-making. However, Labour has stopped short of promising the large-scale overhaul that some commentators, including Hartley-Brewer, say is necessary. With a general election on the horizon, the NHS is shaping up to be a defining issue, and how parties choose to talk about it and propose solutions will likely influence millions of votes. Julia Hartley-Brewer's commentary, whether you agree with it or not, taps into a growing sense of urgency around the NHS. While her tone may be provocative, the core message that the system is buckling is one many Britons can relate to. Do you believe the NHS needs more funding or a deeper structural transformation? Should we be open to new models of healthcare delivery, or fight to preserve the system exactly as it is? Let us know your thoughts in the comments below, and remember, respectful debate is always welcome here. If you found this breakdown informative, be sure to like, subscribe, and click the bell so you stay updated on future political discussions and coverage. Thanks for watching, and stay informed, stay engaged.